Hello, everybody, and I'm speaking in my scrubs from an NHS office, so apologise for the background. Here we are, like the rest of the world, on from when the pandemic began, and in Britain, just over a year ago, we found ourselves, like so many other countries, descending into this pit of being whose dimensions were truly horrifying for anyone involved. I'm an NHS Palliative Care doctor, and this time last year, I asked to move from the hospice where I normally work onto the COVID wards of my local hospital because I just wanted to be where the need was greatest, and I knew that there were so many men and women dying so swiftly and so shockingly from this terrible disease. I'm sure you'll all have seen some terrible images, photos taken from inside COVID hospitals, the barriers between doctors and patients, screens and tablets taking the place of warm, tactile, flesh and blood human beings at their loved ones' bedsides. All of that's been so difficult. I think unless you've actually been there for yourself and seen that with your own eyes, it's very hard to really imagine all the ways in which COVID has completely overturned everything that we know matters about practicing good medicine. By way of example, this is a picture of me last year. As you can see, I hope, in Britain, unlike America, many of us in the NHS were certainly issued with PPE from the flimsier end of the protective spectrum. I wanted to show you this picture of me, though, to make a different point. If you imagine for a moment what it's been like for patients with COVID coming into hospital throughout the course of the last year, there is a really shocking aspect of that experience to contemplate, and it's this. It's that from the moment a patient who goes on to die from COVID arrives in hospital, they are destined never to see a human face again. They are not going to see lips or cheeks or smiles, just an endless procession of masks and eyes behind visors, as you can see in this picture of me taken last year. Now, when I realised this for myself early on in the pandemic, it struck me that what COVID had unleashed, not just upon the medical profession, but upon the world in general, was indeed apocalyptic, but not necessarily in the way we're familiar with. So the word apocalypse was widely used to describe the early months of the pandemic. It's typically a term that's a shorthand for absolute catastrophe, the end of the world as we know it, and I think it was very aptly used last year. Its etymology comes from the Greek word apocalypsis, and apocalypsis means not a catastrophe, but an unveiling, a revelation. Pandemic medicine hasn't only been tough and traumatic, it's been revelatory as well. And I would argue that the last year has taught us a number of things about medicine that are absolutely profound, the most important of which is it has taught us how to distinguish those aspects of medicine that can be refined or amended or dispensed with completely from those other aspects which we absolutely cannot do without. We've learned very, very valuable lessons about best medical practice, often through very painful, distressing periods. And I think it would be spectacularly reckless of us not to do our utmost to take those lessons forwards into how we shape medicine from this point onwards. So the first of these lessons is this: When you're working on a COVID ward and you have all of these barriers between you and your patients, all of the infection control measures such as PPE, you quickly realise that the greatest cruelty of an infectious disease like COVID is the way in which it separates one human being from another at precisely the times when we need human contact the most. The way COVID spreads, for instance, through speech and touch, our usual means of sharing warmth and tenderness with each other. I'd like to share a brief example of this that I experienced last year. There was an occasion, in fact, many occasions, when I would talk to children about something that was happening to a parent or a relative. They would come to the hospital to say goodbye. And one day I sat down with a father and two little girls who had come to the hospital because their mother was dying of COVID. I had to explain to the children that mummy looked very different, and it may be quite shocking when they saw her. And then I had to help them into PPE and kneel down on the floor and help them put on their own masks and gowns. And as I watched this little procession of father, two little girls setting off down the corridor to their mum's bedroom, I saw the plastic of their gowns trailing on the floor behind them. And I thought to myself, that right there is an image that nobody should ever have to see, because it shouldn't exist. We should not be witnessing children trailing plastic aprons behind them. But the fact is, PPE is not made for children. It's only made for adults. And hence that experience occurred. It's one of 1,000 examples of the ways in which COVID has inflicted unimaginable heartbreak for staff, for families, and of course for patients themselves. The second lesson we have learned through this pandemic is about the impact of that on healthcare workers. It's been really unimaginably traumatic to have that fierce impulse to be a kind and humane and compassionate practitioner working with patients in desperate need and sometimes desperately suffering, and yet simultaneously to know that inside a second impulse, and it's an impulse to recoil away from your patient, to try and keep your distance from them because they are suffering from a disease which you know could potentially be the death of you too. And I think we have all found that very, very traumatic, because it has complicated our natural instincts to move in and be close to our patients. The third lesson may be a little more positive, and it's this. It's that although the pandemic has been traumatic and relentless and sometimes heartbreaking for all of us, I think it has also brought out, certainly in my NHS colleagues, the most incredible grit and tenacity and cold, hard, steely love than I ever knew was possible. And the fact is, healthcare workers around the world have carried on transmitting compassion to their patients despite all of those barriers that COVID has thrown up through sheer effort of will. Sometimes it feels like we're not only giving our all, we're giving more than our all to try and ensure that frightened patients know that beneath the masks and the visors we still care, and we're still trying to show them that they matter to us, even if they're in their last days, hours, moments of life. We have been there when family members have been unable to come to the bedside because of visitor restrictions to reduce infection risk. We've sometimes read out the words that a husband or wife has written to their loved one who longs to be there themselves but can't. And we've crouched on the floor sometimes and helped children into plastic gowns and masks. All of that takes real guts. It is much easier not to go the extra mile, to kind of barricade your own heart almost and grit your teeth and try to keep your head down and get through as best you can. I would argue that what the pandemic has taught us fundamentally is that the greatest single challenge for healthcare professionals is operating in conditions that are hectic or grueling or overwhelming, while still finding a way to behave lovingly and compassionately. And I think we have. Why, you might ask, why put yourself through that? And of course, the answer is, as COVID has revealed so brutally, that at any point in a patient's life, whether it is their first day or their last, it is human connection, the way we transmit our care and our love to each other, that's the really vital medicine. Human connection is what makes the difference, other people. To give you one example of this, I cared for a patient called Susan last year, Susan Price. I'm sharing her story with her permission. She had metastatic cancer and she felt as though she was being abandoned when the pandemic began. She said she felt as though someone had opened a bin and just chucked her in it. She wasn't a priority. Her life could be sacrificed. And then she came into the hospice where I work and she was sort of enveloped in care and warmth. And this is what she said. This is a quotation from Susan. It felt like I had just met a human being for the first time. The nurse stopped and looked at me properly. She looked into my eyes and she saw me. I wanted someone to scoop me up. I needed that. It really doesn't matter if you're 3 or 53 as I am. It's still the same feeling. She saw how scared I was and she scooped me up and she somehow gave me hope and confidence. I was still dying, of course, I knew that, but now I had faith someone wanted to help me. That was achieved simply by a healthcare professional making an effort to demonstrate to a patient that they care about them. So, to conclude, I would argue, as a palliative care doctor who this year has seen enough death and dying to last a lifetime, above all, what this shattering year has taught us is this. We've endured barriers and separations and absences and estrangements this year in every conceivable way. And what they show is that what we absolutely cannot do without in medicine is care and love. Proper, hard as nails, taking everything, healthcare workers conveying love and warmth and human kindness to our patients. We need to fight tooth and nail and use every bit of technology we can, as creatively as we can, to carve out the conditions, particularly in a pandemic, that allow love to flourish in medicine. So I'm ending with an appeal. However we move forwards from this pandemic, please let us prioritise the human connection, because without it, doctors, medics are nothing. We have to keep medicine human. Thank you very much.